We're also joined by Wendell Potter, who is a former top executive for health insurance companies Cigna and Humana. At Cigna, he served as head of communications. He's author of Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. He's now president of the nonprofit Business for Medicare for All. Wendell Potter, take us from then, back when Medicare and Medicaid was fought. It was then passed, became one of the most popular programs in the United States. And then your own trajectory, what you were doing as the top executive at Cigna and at Humana, one of the top executives, what you were saying about Medicare and Medicaid.
Well, in my first career, I was certainly saying that let's privatize Medicare. Let's see what we can do to get as many people into private plans as we possibly can. And when I first went to work for Humana in 1989, Humana was selling private managed care plans in the Medicare program. And that has become a big cash cow, by the way, for the insurance industry. But what happened after the Medicare program was enacted in 1965, we just kind of stopped. It was the intent to bring everyone into the Medicare program eventually. But what happened instead was that we allowed private industry to create and construct what has become a Rube Goldberg contraption that exists to make money for big corporations like the ones that I used to work for. And the reason that we have ever-increasing prices in this country is because all the players now are working very symbiotically. Insurance companies cannot control healthcare costs, nor do they want to. So I left my job in 2008 as head of corporate communications at Cigna. After a crisis of conscience, I realized that what I was doing for a living was making it necessary for people to go without insurance, or even if they had insurance, not being able to go to the doctor because of high deductibles. It's only gotten worse since then. Even after the enactment of the Affordable Care Act, we're seeing once again the number of people without insurance go back up, and the number of people who are underinsured, who have health plans that are inadequate, is really skyrocketing. So we're at a point in our history in which we absolutely have to say this isn't working for anyone except big corporations and their executives and their shareholders. We've got to do something more than just tweak the Affordable Care Act to get to a system that is more like countries in the other countries in the developed world.
As I was leaving today, right before the broadcast, CNN was doing yet another piece. This one was how Finland's socialized medicine program is failing. Bernie Sanders pointed out 2 nights ago in the debate, he was taking on not only some of his these other Democratic contenders for president, but CNN itself and how they framed this discussion, and that he pointed out in a few minutes they would be running for sure a pharmaceutical ad. So talk about how this is being framed today.
It's being framed in the way that I used to frame it myself in my old job, because I used to be a part of the effort to get people to believe things that were not true about the system in Finland or Canada or the UK. I spent a lot of time developing relationships with reporters and producers at places like CNN to get them to talk about healthcare in a way that we wanted them to talk, and to ask questions and to say things that just simply were not true, or that, taken out of context, would get people to believe things that was just not an accurate portrayal of a healthcare system. We focused a lot, by the way, on Canada, and one of the things that I'm doing in particular is apologizing to the American public for all the misleading that I did in my old career to get people to think that people wait a long time to get care in Canada and other countries. It's just simply not true. But the insurance industry and its allies are spending enormous sums of money, and that money is your money, by the way. If you have private insurance, you're spending money to pay for the propaganda campaigns. The insurance industry, the big hospital companies, the big drug companies have come together. They're pooling money to create a front group called the Partnership for America's Healthcare Future. It's the latest front group that the industry has created over many years. I used to be a part of efforts to work with these front groups, and they exist to mislead people and to get the media to say things and frame questions the way that they want them to be framed.
I want to turn to Trump. Go ahead.
Go ahead.
I want to turn to Trump appointee Seema
I've often called it,
the administrator of the Centers for Medicare and Medicaid Services. She spoke at the Federation of American Hospitals 2019 annual meeting earlier this year.
Medicare for all, in reality, is Medicare for none. This isn't hyperbole. As the administrator of one of the largest government-run healthcare programs in the world, I see every day its shortcomings. It's true that our present system needs improvement. However, doubling down on government and mimicking the failed socialist healthcare systems of Europe that ration and restrict care, where patients face long periods of time for care, is not the answer.
That's Seema Verma, Trump appointee. Your response, Wendell Potter.
Well, she's using the same talking points that the industry wants her to use. It's just a continuation of what we heard Ronald Reagan saying 54 years ago or longer. I've often called these talking points evergreen. They trot them out to scare people every time there is a threat to profits, and we're seeing that again. It's not going to work this time because increasingly people are not spooked by terms like socialized medicine. People are realizing day in and day out that they've been sold a bill of goods by the insurance industry. What we do in this country is ration care based on ability to pay. There are Americans all over this country who do not get the care that they need, not because we have a socialized system like another country. We don't. And even that term socialized medicine is used purposely to scare people. We don't let people get the care that they need because people don't have the money to get the care that they need. In particular, we're talking about people who are so-called middle-income individuals and families. They just simply, in many cases, cannot afford to get the care that they need because they, in many cases, can't afford insurance. The Affordable Care Act did some good, but it provides subsidies for people who have relatively low incomes. It doesn't do much of anything to protect people who have so-called middle incomes.
Let me ask you a quick question.
People who are rich and people who are at the lower end are doing okay.
We just have a few seconds, and of course we'll continue this discussion in the many months to come. But when you were an insurance industry executive, head of communications, you work with Humana and Cigna, did you find the networks more receptive to you because you were pouring millions into advertising?
Oh, no doubt about it. You see a lot of ads from not only the insurance industry, but certainly the drug companies. They absolutely are. They're not going to have stories. They're not going to do investigative pieces on an industry that pays them a lot of money. Absolutely.
We're going to leave it there today. I want to thank you so much for being with us. Wendell Potter, former executive for health insurance companies Cigna and Humana. He served as head of communications at Cigna, author of Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans, now president of the nonprofit organization, of a nonprofit organization around healthcare. And Janet Golden is professor emerita at Rutgers University and historian of U.S. medicine. We'll link to your piece in the Philadelphia Inquirer. Happy birthday to Medicare and Medicaid.